Go Houston. But yeah, we can go ahead and get started. Thank you so much for that idea, Caitlin. I really like the introductions. That way I get to know a little bit of where everyone's coming from, the different backgrounds, and also how far along in your training you're at. Rebecca, we're just doing introductions. I don't know if you can or want to unmute yourself just to say where you're from, who you are.
Hi, yeah, I can talk. My name is Rebecca Ricky. I'm a second year student at NSU KP I'm from Chicago originally, so nice to meet you guys.
Okay, yeah, thank you so much for joining us. Okay, so we're gonna go ahead and get started. I'm gonna share my screen and we'll get this party started. Let's see. Let's do this one. Okay, can you see my screen?
It's loading.
Yes.
Okay, good.
Yes. Okay. You know what? I'm gonna make an executive decision, then just move to my daughter's room now. Just prophylactically. Prophylactically, we're going to a better room with better Wi-Fi. All right. So today's presentation, I wanted to kind of gear it more towards the beginner and intermediate students, but also, I feel like I wanted to just give you some pearls and tips that are applicable to all levels of Spanish speaking, pre-medical students, medical students, and residents. Um, it obviously this is not all encompassing. You're not going to get all the information that you need from just this one presentation, but hopefully you find it educational and fun. So the title of my presentation is First Impression Matters, using medical Spanish and cultural humility competency to build a lasting relationship with your Spanish speaking patients. So that's kind of what we're talking about, thinking about your introduction to a new patient who's Spanish speaking. How can you maximize um, your rapport with them? How can you make sure that it's a good interaction? So welcome to Spanish class. Most of the presentation will be, the majority, pretty much everything is going to be in English. I will be giving some examples in Spanish, and then also, encouraging participation from the group and asking y'all to kind of contribute as well. But by large, the majority of the presentation will be in English. Let's see. Okay, so what are the objectives for today? So there were a couple of things that I wanted to make sure that we addressed during today's presentation. First of all, anytime you do a presentation, you want to think about why is this important, right? Why are we even talking about this? So I wanted to hit you with some data about why it's important to be discussing medical Spanish, how it affects our demographics and our population.
Sorry,
Number two.
I just
Uh-huh.
wanted to say that we can't see your slides like advancing, I guess. It's still on the first slide for me at least. I don't know if that's the case for everybody.
It is for everybody. I see some
here.
nods.
Yes.
Hmm.
Yes.
Let's see. I see something on the chat too. Yeah, same thing. So it's still on the title slide?
It's still like it's just on the like non-presenter mode, just like we see all this.
Ah. Oh, I think I know why. I think it's the way I might have been sharing the screen. Let me just share everything. What can you see now? Can you see everything?
Your desktop, yeah. Okay.
Okay. Now we're good? Okay. No wonder nobody laughed when I put the slide. Okay. Yeah, so welcome to Spanish class. Again, that's my name. I'm a second year resident at UT San Antonio, PM&R resident. So, yes. So these are the objectives. Thank you for catching that, Lucila. I appreciate it. Please speak up if there are other technical difficulties. But yeah, I wanted to talk about why this is important. I wanted to discuss cultural humility and competency and make sure I define those things, make sure people know what the differences are between the two. Talking about some common practices and maybe some misconceptions regarding Hispanic culture and healthcare in general. Just things that as a Hispanic person myself, I've heard other people say, and I'm like, I don't know if that's true. Um, I wanted to identify some do's and don'ts when working with a Spanish-speaking patient, give you some tips on how to prepare and perform your first encounter with a Spanish-speaking patient, and then actually have some cases at the end so we can kind of practice together. And I think that's where some of the more medical Spanish practicing will come into play. So you may be asking like, why you? Why am I giving this presentation? What kind of qualifications do I hold? I was born in Mexico, first and foremost. So Spanish is my native language. I learned that way before I learned English. I was born in the Baja California Peninsula. So for all of you guys that said that you're from California area, I'm from Mexicali, about 2 hours away from the San Diego Tijuana border. Um, I used to be the chair for the PM&R Scholars Medical Spanish Network last year. Um, Spanish language, I did want to say, as with any other language, has a lot of many different regional dialects and variations. So some of the words that I may use may mean something differently to somebody else from another area of Latin America, and even within the same country, like within Mexico, Northern Mexico, Southern Mexico, Central Mexico, they might mean different things. So just keep that in mind. Um, and then the big disclaimer that, the vocabulary and the tips that I share in this lesson are not meant to make you like a fluent speaker right away, obviously, but rather I just want to get this conversation started, pique your interest in wanting to pursue more medical Spanish, learn more about it, and how it benefits you as a healthcare professional, and how having that as a tool in your toolkit will help you whenever you're dealing with Spanish speaking patients. So why is this important? As some of you may know, the Hispanic population is like the minority majority here in the United States. We make up around 19% of the total population, and we're expected to continue to increase over the years. Per the 2019 census, there's approximately about 42 million people that speak Spanish as their primary language in the United States, and around 12 million that speak English and Spanish at home. So I couldn't verify whether that was like if the 12 million was coming from the 42 million or if the 12 million was in addition to the 42 million. But worst case scenario or best case scenario, there's like 30 million people who are only Spanish speaking at home with no English, which is still a huge population. And unfortunately, only about 6% of physicians identify as Hispanic, and just about 2% of non-Hispanic physicians are Spanish speaking. So it's a very small population, and it's definitely not proportionate when you look at how much the Hispanic population takes up in the United States. Um, as expected, research has shown that patients without language concordant health uh, providers are more likely to experience miscommunication and adverse events, and are less likely to comply with medications and medical advice, and also less likely to follow up, which makes sense, right? If you go see a physician and they don't speak the language that you speak, you're going to find it very hard to want to continue to see them and follow the instructions, because one, you may not understand them, and two, there might not be as much trust. So just something to consider. So I've had people ask me, isn't cultural humility and competency the same thing? Like what do they mean? What does it matter? So I wanted to make sure that I define these terms for y'all. So cultural humility is an ongoing process of self-exploration and self-critique, combining with a willingness to learn from others. So basically saying like, I don't know everything there is to know about people and their backgrounds and how they're raised. So I make myself aware of that. I know that not everyone is coming from the same background. And so their understanding of how things work and the understanding on like their social norms and the things that they think are important and all of that may differ from what I consider to be important and things like that. So basically, putting yourself in a situation of understanding that other people have different thoughts and ideas based on their backgrounds. So again, entering a relationship with another person with the intention of honoring their beliefs, costumes, and values rather than trying to enforce your own ideas on them. And then recognizing that there's power dynamics and imbalances, and having a desire to fix those power imbalances and to develop partnerships with people and groups who advocate for others. So cultural humility, very important, because it puts you in a position of seeing with eye to eye with your patients, and not necessarily and making yourself aware and conscious about the ideas that you're putting forward with your treatments and the way you communicate with them, and understanding why they may feel a certain type of way about some of the treatment options that you offer. Cultural competency, so cultural humility that can be practiced like at an individual level. That's something that all of us as healthcare providers and future healthcare providers should definitely incorporate into not just healthcare, but like our everyday life. We should seek to build relationships with people that are from different backgrounds because that's how we like enrich our own life and experience in Earth in a way. Cultural competency is more instead of rather being just like an individual, this is something that's more of systemic. So in order to be culturally competent, there has to be a congruent behaviors, attitude, and policies that come together in a system, agency, or amongst professionals to work effectively in cross-cultural situations. So now, with cultural humility, you're telling yourself, I understand that other people have different backgrounds and have different ideas and come from different experiences. In cultural competency, you understand that, and now you seek ways to incorporate those things to make sure that your patients are receiving the care that they deserve and the care that they should be getting. So the five essential elements that are part of cultural competency is valuing diversity, having the capacity for cultural self-assessment, which kind of comes with cultural humility, being conscious of the dynamics inherited when cultures interact, having institutionalized cultural knowledge, and having developed adaptations to service delivery reflecting an understanding of cultural diversity. So again, we understand that diversity is important. How do we account for other people's backgrounds to ensure that they deserve the care that they to ensure that they get the care that they deserve? So common practices and misconceptions. The big thing is making sure that we don't make any assumptions, right? That's the last thing you want to do. Uh, there's a lot of stereotypes about a lot of different cultures, different people for a whole lot of reasons. You just got to make sure that, yeah, you can, there's generalizations that are made about groups, and sometimes there are basis for them, but you want to make sure that you never assume anything about a patient and you always ask them things. You can use those generalizations to kind of serve as like background and help you get a conversation started, but don't assume that because they're from a certain background, they're gonna go ahead and follow these set of rules. Because we're all individuals with different experiences and different beliefs. So the main things that you see, having said that, one of the big things that you see with the Hispanic culture is a huge emphasis on family and faith. Those are very strong pillars. But again, you never want to assume that just because someone is Hispanic, they come from a very big, strong, united family and they go to church every Sunday or whatever. And like, you don't want to make those kinds of assumptions, but it's just something that you want to keep in mind because it can help you, you know, if you do walk into a room and you see a lot of people in the room, then you're like, oh, okay, maybe they can play a key role in the treatment of this patient as you're like working with them. Another big thing that we see a lot in the Hispanic culture is respect for the elders. Um, you want to make sure the recommendation that I give is whenever you're addressing an older patient, you address them by their last name. I feel like in American culture, like that's also pretty common, but not always the case. I think in Hispanic culture, it's really good to just default to that. Um, Older people just go by their last name. If they want you to be addressed by their first name, they can let you know. Another way that you can approach it is you can just ask them how they would like to be addressed. But if you want to just play it safe, I typically just address patients by their last names, especially if they're older, and then have them correct me if they want me to call them otherwise. If your Spanish is advanced, I would definitely recommend using usted rather than tú whenever you're addressing these older patients. Um, as you're learning Spanish, like if your Spanish is not very advanced, it will obviously show when you're speaking with the patient. So if you use the tú pronouns or whatever, they're not gonna, most of the time, they're not gonna fault you for it because they know that you don't speak it as well. But if you're a more advanced speaker, I would definitely recommend being formal whenever you're speaking to your older patients and then having them correct you if they don't want you to address them that way. Um, so for those of you that don't speak a lot of Spanish, usted and tú are just two different versions of you. In Spanish, we have you, and in English it's you, but in Spanish it's tú or usted. And it's just like based on the profession that someone's in. So if you're like deemed to be like a professional, typically you use the usted pronoun. And then also like if you're older, it's again out of respect. So here's how it would look like whenever you're speaking, or sound like whenever you're speaking to a patient. So instead of saying "Cómo te llamas?", you would say "Cómo se llama?" So instead of "te se" or "Con quién vive usted?", instead of "Con quién vives tú?". So you'll see that a lot of the time it's like you're just taking away the S at the end, like "¿Qué síntomas tiene?" instead of "¿Qué síntomas tienes?". Um, Again, just being formal. And sometimes that can help building those kind of good relationship with your patients early on if you showing respect towards them in that way. Some of the things that I wanted to address on the misconceptions and common practices. So, in general, what I have seen is there's a lot of respect from Hispanic patients towards their physicians. Again, physicians in the Hispanic culture are seen as like this like really great profession that they're admired because they went through like really tough education to get to this point. So typically, you see Hispanic patients really respecting the physician, taking whatever recommendations that you give as like the final word, and then just being like, yes, doctor, whatever you say, doctor. Um, so one way that you can really build that relationship with those patients, it can be a little intimidating for them, especially if they don't have a lot of background in healthcare themselves. It can be a little scary and intimidating for them to try to start a conversation with you. So the best thing that you can do to build rapport is kind of the same things that you would do with an English speaking patient, which would be, getting to know them, asking them about their life, their profession, their family can be a huge thing. That's a great way to build rapport. Um, the one caveat or thing that I would throw in there is that, you got to be careful, especially with how the times are now, politically and all those things. If you don't approach the conversation in a very warm way, and then you just go up to them and you're like, "Where are you from? Who's your family?" Like they may get a little scared about that and maybe a little bit more skeptical and anxious about sharing answers to that because they don't know what your motives are. And so you want to make sure that whenever you're approaching them and asking them questions about their profession and their hometown or whatever, you want to make it as natural as possible and make sure that you're stating that really you're just wanting to get to know them. Um, Come into the room, take a seat by their bedside, and just start a natural conversation rather than walking into the room, pointing at them and saying like, "Where are you from?" Like that's gonna scare them. Um, Also, don't assume that because family is around that the patient wants them, one, to be there, and two, wants them to translate or interpret. That's a big thing. We want to make sure that we're protecting patient information just like we would with any other patient, and only disclose information to their loved ones if they allow it. So families can be very involved, like we talked about, not always, but in general. And so we want to make sure that, some of them will come up to you and say, like, "Hey, what are the updates? How's my dad doing? How is my uncle doing? Like, what's going on?" You want to make sure that before you share any information with the family member, you check in with the patient and ask if that's okay to do. Don't just assume that because the family's always in the room and they're cracking jokes and they spend a lot of time together, that the patient wants the family to be, one, involved in his care, or two, even know anything about what's going on with them medically. Um, a huge one is refrain from using children as interpreters whenever you're speaking with a patient. Traumatic. A trigger warning for all of you who have had to do this before. Uh, you know, for a regular conversation about like wanting to go get milk at HEB, sure, the kid can translate. When you're in the hospital and like your uncle is septic or whatever, you do not want to be the kid that's translating that to or interpreting that for your family. So do not use the kids. And typically, like I put here, unless a patient insists. But even then, I would always. So what I typically default to, and you'll see this later in the conversation in the presentation, I just default to hospital policy. Like, oh, I'm sure like your kid would do great in translating for me, but I'm just gonna use this interpreter because that's what the hospital wants. I'm gonna get in trouble if I make your kid interpret that kind of stuff. Just protecting the child, making sure that the information gets to the patient correctly, because again, you're gonna be chances are when you're speaking to them, you might be using big words, medical words, and they may not know how to interpret those words. My general recommendation for non-native, non-advanced Spanish speakers is to use the interpreter services at your hospital to address medical issues and information. So, medical Spanish and just general Spanish is very different. Just because you're fluent at the taqueria in the corner here doesn't mean that you're like qualified to go and give like speak medical Spanish to your patients, obtain consent and those kinds of things just because you took Spanish 3 when you were in high school. So unless you're like very advanced, a native speaker, have taken tests, are very familiar with medical Spanish, I would just say use the interpreter services for that are available at your hospital to address medical issues. If you're wanting to just have like a regular chat with the patient, getting to know them a little bit better, learning about their family, those kinds of things, that would be a perfect time to practice your Spanish if it's just like a general conversation. Um, but again, if you're dealing with like documentation that's for the hospital or updating on medical issues, stick to the interpreter services unless you're very confident that you're at the level that you need to be to do that in Spanish. Any questions so far? Okay. So now we're gonna transition to kind of that first impression part. So we're gonna go through kind of like a checklist of different things that you want to make sure you do whenever you're gonna go meet a Spanish speaking patient for the first time. So we're just gonna say we're in a consult service at Grace Sloan Memorial or whatever, and we just got a new consult, and the patient only speaks Spanish. So how do you prepare for that? What do you do? So a lot of the prepping is it's just the same as what you would with an English speaking patient. So you want to make sure you chart check. Don't assume that they have family support. You should always be asking about their social history during that initial interview. So you should be asking, who do you live with? Um, how many stories in the house? How many steps to get into the house? Do you have a walk-in shower, a tub, or like a combo? Like all of those questions you should ask. Um, Before you go into a room, kind of plan ahead what you're going to be asking these patients. Big things are always you want to make sure you're assessing orientation, especially if a patient had like a brain injury in physiatry. You want to make sure that you're assessing orientation because if you go in there and start asking them questions and you don't assess orientation, they could like just say a bunch of BS. And then later on, you ask them like, "Oh, where are you?" They're like, "Disneyland." And what's the date? 1972. And you're like, oh my gosh, like we just spent 30 minutes talking and now I just learned that like you don't know where you're at? You want to ask them about the symptoms that brought them to the hospital, what their course has been, in their own words, and what their understanding of their situation is. You want to ask them about like what are the current issues, things that they want for you to address. And then again, all the other good stuff that you would typically ask, past medical history, surgical, allergies, social, prior level of function. Um, Depending on your Spanish, again, you might need an interpreter to get this kind of information, or you may not. If you are going to need one, make sure you're ready. Some hospitals are going to be they use like their phones, and it's just like someone that you call. I've seen hospitals that have like the iPads. I see hospitals that have in-person interpreters. So obviously, if you're able to get your hands on an in-person interpreter, that would be ideal. If not, I think a tablet one would be better, like so they can see your face. And then if not, then obviously a phone if it needs to be that. Just make sure you're like trying to keep eye contact with your patient as you're speaking. I see a lot of people like turning to the iPad or turning to the interpreter or just like looking at their phone while they're talking. And again, it's not as personable. More tips that I had for that first encounter. Don't assume that they only speak Spanish. Always ask what their language preference is. Here in San Antonio, where I'm at, there's a lot of Spanglish speakers. And so you just want to kind of clarify if they have a language that they prefer. Because they may speak both, but they might feel more comfortable speaking in one language over the other when it comes to medical information. I highly recommend if you have a Spanish speaking only patient, even if you have an interpreter with you, try your best to introduce yourself to them in Spanish. Doing little things like this really helps with that relationship, building that trust with the patient. it shows that you care and you want to go that extra mile. So just try to memorize like hola, me llamo, whatever. And so like even something as simple as that, I think the patient will appreciate if you do something like that. Obviously, if you say that and then they start speaking at you a million miles an hour, then you can be like, time out, hold on, let me get the interpreter because I'm not catching this, you know? I'm not picking up what you're putting down. Um, once you're speaking and using the interpreter, clarify if there is any confusion with any questions that you ask. You know, everyone is human, no one is perfect. And I've witnessed multiple times, multiple occasions where an interpreter might have heard the physician wrong, or they just made a mistake and didn't translate, or I'm sorry, interpret correctly. And then it kind of like confuses the patient. And then then they're not talking about what you're talking about, and then it's like a whole mess. And so you want to make sure that if you're saying something and then the interpreter says it to the patient, and you're looking at the patient and they look confused and they look like they're not tracking on the conversation, try to find other ways of saying the same thing until you can tell that they're understanding and tracking on the conversation that you're having. So always clarify if you're getting a sense that they're not really understanding what's going on. It could be because they just like they don't understand what the topic that you're discussing, or it could be that there was a miscommunication on the interpreter's end. So always better to play it safe and clarify. Remember to start formal, especially for your elderly like patients. Start formal, and then match their vibe. If they're really cool, if you're like, "Hello, Mr. Gonzalez," and they're like, "Please call me Rudy" or whatever, then you're like, "Oh, nice, okay, hola, Rudy." Be respectful. Ask if it's okay to discuss medical information with the family in the room. Some of the things I'm stressing a lot because I've seen it happen quite a bit of times. So again, don't assume just because family's at bedside that the patient wants them to know. If you may need to discuss sensitive topics, including things like sexual function, bowel, bladder continence, those kinds of things. If family's in the room, always let the patient know ahead of time. Hey, some of the questions that I might ask you are going to be sensitive topics like, would you like your family to step out? Are you okay with them being in the room? I've seen it happen with spinal cord injury patients where we have to ask these kinds of questions. And so you don't want them to get caught by surprise and then be like I don't really want to talk to you about this right now in front of them. When you're doing a physical exam, your initial physical exam, make sure that you talk your way through it as you would with an English speaking patient. Don't just say like, oh, there's a language barrier, so I'm just gonna go for it. Explain what you're doing. That way the patient feels a little bit more comfortable. Don't just like put your hands on them. And then the last like little like sorbet moment at the end that I like to use is I always like to sprinkle a little like God bless you on the way out in Spanish. Que Dios lo bendiga. I know not all people are religious, again, making a big generalization here, but if they're into that, they really appreciate it. And typically if they're not, they're just like, whatever. Like they're not gonna be like, how dare you tell me like God bless you. Like no, people are not gonna get mad at you for saying that. So I like to sprinkle that in there. Again, I think it's another great way of a little gesture that can go a long way with the patient to build a relationship. Not all Hispanics are religious, but in case that they are, they will really appreciate something like that. And it's pretty benign if they're not. So again, going through the do's and don'ts of approaching a new patient, you want to make sure that you do a thorough chart check. You want to make sure that you ask their language preference. You want to try your best to introduce yourself in Spanish. You want to get an interpreter if you need it. You want to address the patient respectfully and start more formal. And then ask if it's okay to share information in front of their family if they're present. And then if they're not present, you can always ask them if it's okay to call and update the family. Because again, some of them, even if family is not at bedside, they might have a huge support system and they might want to have their family involved. So you should ask if you want them, if they want you to reach out to their family. Don't assume that they only speak Spanish or that their English is good enough. Again, I've seen that a good amount of times where a resident will walk in, they say hi to the patient says hi, and then they're just like, oh, they said hi, they speak English, and then they just like take off with their English. And it's like, wait. Then you start noticing that the patient is not really tracking. And then when it's the patient's time to talk, you can see they're kind of stumbling on their words, trying to put their sentences together. Don't ask children to interpret. Don't address older patients by their first name unless they say it's okay. And then don't share medical information with other family members without consent from the patient. Any questions about this? Perfect. So we're gonna do some cases together. This is where we all have the opportunity. This is where it becomes more of a conversation. And you'll see. It should be fun. So I'm gonna actually have someone read this one. Let's see. I see Ellie on my screen. Can I have you read case number 1?
Okay, so Mr. Juan Dominguez is a 72-year-old male with a past medical history of hypertension, hyperlipidemia, type 2 diabetes. I'm not sure what the CP means. Peripheral neuropathy, PVD, presented to Sloan Gray Memorial with the wound to the right foot. Patient was found to have OM and is now SP right BKA. Consult placed by a primary team for evaluate for ARU after PTOT. Saw patient and recommended ARU for his disposition. On initial chart check, you see that Spanish is the patient's primary language. Found a social work note that states that patient is divorced with 3 kids. For this case, we're going to assume that your Spanish proficiency level is intermediate.
Thank you, Ellie. So yeah, you have this patient. They had an infection from a wound in their foot. So now they have an amputation to their right side, right limb. So we're gonna go see them, and their Spanish. We're gonna assume that we are intermediate. So if you're an intermediate speaker on the call, this is your opportunity. You're being seen right now. So Mr. Juan Dominguez. So there are no in-person interpreters at your hospital, but they do have iPads that you can use for the interpreter services. You grab one that was a 35% charge, and that was 35% charge, and then you take it with you. So when you walk into the room, what are some things that you want to say to the patient? Just curious. There's no right or wrong. There's wrong answers, but just throw it out there. What would you say to a patient?
I would introduce myself. So I would say like, hola, mucho gusto. Mi nombre es Eli. Voy a estar, actually it's hard. Okay. Estoy viniendo para hablar sobre qué lo trae aquí hoy. That kind of would start out, something like that.
Okay. So introducing yourself, you want to share that you're part of the team, and that, kind of stating, so Ellie was kind of sharing like, I'm just here to learn about what brought you here to the hospital, like what we can help with. What are some other things that you guys are thinking about?
I would explain that I'm getting the interpreter on the line. So espera un momento, por favor. Estoy consiguiendo un intérprete para esta conversación, para que pueda fluir más, sí, más eficiente.
Yeah, that's great, Stacy. Yeah, that's wonderful. So explaining, if you're going to be using the interpreter services, you can let the patient know as you're pulling things up, hey, I'm going to be using the interpreter services just because I want this conversation to be more smoother. I want it to be more fluent. So that's great. Anybody else? You can also say it if you don't feel like you are at the level where you can say it in Spanish, you can also say it in English, and we can help you translate it.
Setting the scene, is there anybody in the room with the patient, Mr. Dominguez?
Mm-hmm. Or if you see some, go ahead.
Necesito hablar con tú de información médico sensitivo. Es bien que habla con tú con su familia aquí, o prefieres prefieres su familia cuando hablan con información sensitiva, o vamos a uh, un otro lugar, o habla con esta información sensitivo en un otro tiempo.
Mm-hmm. So Matthew, so he's saying, we're going to be speaking about some sensitive subjects. Is it okay for your family to be here? Or would you prefer that the family be in another place? Or would you prefer to talk about the sensitive stuff later on? Right, Matt? That's what you said. That's great. Yeah. So, I would say so saying that the way I would say it, I would say like, hola, introduce myself, all that stuff. And then I would say, veo que tiene familia aquí. I can see that you have family here. ¿Cuál es su relación? What is your relationship with this person? So then that, again, you're figuring out who else is in the room, what is the relationship to this patient. Um, then they can tell you who they are. And then you can say, okay, vamos a hablar de sus condiciones médicas. We're going to talk about your medical conditions. ¿Está bien que estén ellos presentes? Is it okay if they're present? That's just another way of saying it. But I think the way you said it is good too, Matthew. Just like um, depending on how advanced your Spanish is, you may choose to abbreviate way certain way. But as long as if I was a Spanish speaking patient only, and you came to me and you said that to me, I would know exactly what you mean. So that's great. So we talked about it. What are some things you want to say? So this is what I said. I said, hola, buenas tardes. Yo soy el doctor Valdez y soy un doctor de rehabilitación física. It's important to kind of let them know what profession you're in, what team you're with. If you're in a hospital, these patients are in a hospital setting, so they might be seen by different physicians. So kind of separating yourself, saying I'm a physical medicine doctor. Prefiere hablar en español o inglés. So again, I'm not, even though on the chart it says Spanish speaking, I want to ask and confirm that that's what he wants to do. So I ask English or Spanish, and then I'm gonna say, again, I'm intermediate speaker, so I'll say, no hablo mucho español, así que usaré o utilizaré un intérprete. So I don't speak a lot of Spanish, so I'm gonna use an interpreter. Or again, the way Stacy said it, which was like, just give me a second, I'm gonna get the interpreter on the line just so that the conversation is smoother. So what do you want to do next? We talked about um, what else we could do, asking about the family and those kinds of things. But don't forget that you're speaking with don't forget to ask and confirm that you're speaking with the right person. I think that a lot of times, and I've seen this with when I was in medical school and even in residency, whenever you add the layer of someone speaking a different language than you, it kind of like fogs your brain and people go into like a little fight or flight mode and they forget the fundamentals. And so you got to remember not to forget the fundamentals. You should always confirm that you're speaking with the right person. You should always ask them, ¿cómo se llama? ¿Quién es usted? Like you're confirming you're in the right room. And then you can ask them again if it's an older patient. I think this patient was in their 70s, if I remember correctly. Yeah, 72. So if it's an older patient, you ask them like, how would you like, prefiere Señor Dominguez or Juan, Don Juan? Like, what do you prefer? You know? And then he didn't happen to have any family at bedside. So what do we do about that? Any comments? You don't have to say anything in Spanish, just ideas.
Would you just ask if they have any family members coming?
Yeah. So again, we're not gonna assume that everyone, because they're Hispanic, they have a super involved family. But I think just in general, even with an English speaking patient, you want to ask them about their family, their support, especially for rehab purposes. And then you want to ask, yeah, if you can help, if there's any family that will be involved, anyone that's gonna come and visit, anyone that you would want us to reach out to. I think that's important. And you obtain that through your social history. And then did you forget to charge the tablet? Don't forget to charge the tablet on your way out. Because somebody else is going to need it. And it was already at 35%. By the time you ended that encounter, it's probably at 12% now. You don't charge it, the next resident that comes in and grabs it is going to be dead. And then they're going to have to use a phone and it's not as personable, So don't forget to charge the tablet. All right, we're going to move on to case number 2. This is Mrs. Elena Hernandez. I'm going to have Josh. Can I have you read this one?
Sure. Yeah, we have Mrs. Elena Hernandez is a 26-year-old female with a past medical history who was by BEMS after being involved in a motor vehicle collision. Patient had reported LOC for around 5 minutes per friend who was in the crash. Head imaging showed no brain bleed. She also sustained bilateral pelvic fractures, and she is SP RRIF by ortho. Primary team consultant for disposition recommendations. As always, oh, you want me to read that too?
Yeah, you're good. Keep going.
As always, chart check patient and did not see any Spanish flag on the chart. Per the HMP, patient is married with 2 children. For this case, you are a beginner Spanish speaker.
Perfect. Thank you, Josh. So yeah, the Spanish flag that I'm referring to, different medical records are going to have different ways of identifying this. Um, in my hospital, in the hospital that I work at, or in one of them, they use Epic, which is very commonly used in a lot of hospitals. And on Epic, under like their name and profile and things on the left upper side, under their face, under their name and their picture, if they're Spanish speaking or any other language other than English, it will show there and it'll be a little bolded. So that's what I mean by like the Spanish flag. But different medical records may use different things. Okay, so again, 26. She was in a car crash. Uh, she passed out for a while there, but they didn't have any bleeds. She had some fractures too, and they did some surgery on her. Okay. So you show up to interview her, you knock on her door, and you introduce yourself in English, because again, this one doesn't have a flag, right? And you say hi, but you can tell us something. She says hi to you, but you can tell us something is off. The husband happens to be at the bedside, and then he starts interpreting your introduction to the wife. What do you do next? In English, in Spanish, whatever. Well, actually, you're a beginner uh, level, so you can only do stuff in English. Let's look at the chat. Ask if they prefer Spanish. That's good. Yeah. So asking if they prefer Spanish. What else can you do?
Introduce yourself.
Mm-hmm. So you've walked into a room, you've introduced yourself, and then as you're talking to them in English, because you don't know that they're Spanish speaking, that's when you notice that there's something's off. So you can you can grab an iPad to interpret, um, ask if they prefer Spanish. So if you're a beginner speaker, you might be able. So is anyone here a beginner? Like, do they not know a lot of Spanish? And if so, how would you tell someone um that, or how would you ask them if they speak Spanish? How would you approach that?
¿Qué lenguaje tú prefieres, español o inglés?
Okay, yeah, yeah. Or you can even say, like, literally, you can just say español, español o inglés. And maybe that will should be like, oh, okay. So, but yeah, do you prefer Spanish or English? So I would apologize, because I walked in guns blazing. I got a couple other things I needed to take care of, so I ran in there thinking she was English speaking, and then now I realize that she's not. And then I'll say, hey, I'm sorry, like I didn't know you don't speak English, or that you were only Spanish speaking. If I'm a beginner, I'm not gonna be able to apologize in English. So I just say like, time out, let me get my iPad, like somebody was saying, and then we can continue the conversation. The husband, what if I told you that the husband speaks some pretty good English? Like when you are like, oh, my bad, Espanol, and then he's like, oh no, I speak English. What would you do?
I would still keep the iPad just because if it's like I mean, this case is kind of simpler, but if it's a difficult case or he's not very good with like medical terminology, you don't want to make that mistake. And so grabbing the interpreter would like guarantee that there's like nothing missed and properly
Yeah.
communicated to them.
Right.
Yeah, I agree. Also, like, if by chance, like, the patient isn't comfortable with their husband being there, or if they have like sensitive information that they don't want their spouse to know, you'd still need the interpreter.
Exactly. So those are two really great points. Thank you all for sharing. So one, yeah, he may know English and Spanish, but is his medical English and his medical Spanish good enough? And then two, we're not here to talk to him, we're here to talk to her. What if she doesn't want him to know her information? Now, if you're using him, even if so the follow-up question, Josh, that I was gonna ask you was gonna be, let's say he does know really good, let's say he's a physician. He knows all the medical Spanish and medical English in the world. Would it in that case, would it be okay to use him as an interpreter? The answer should probably be no. We should still check with her to see what she prefers. So let's say they decline the interpreter, but you can tell the husband is struggling to interpret. You know, it's a pride thing. I'm a guy, I got this. I can do this. And they're like trying to interpret, and you can tell that he's struggling. What do? Just offer the services again. And like I said, you always want to be cautious. You always want to cover your ass. So you can always just blame it on the hospital. Hospital policy. Hey, I really appreciate that you're taking the time to try to interpret for her, or to her, but my hospital wants me to use the interpreter services. We're paying a lot of money for these iPads, so they need to get used. But I really appreciate you like going out of your way to try to interpret for her. Okay, extra pointers for case number 2. Did you assess for orientation? I don't think we discussed that, but she had a TBI. She passed out. So before you start with your actual interview, you know, you're gonna get thrown off, right? Because you thought she was only English speaking. Now you learn she's Spanish speaking. Now you get an interpreter. You spend 20 minutes talking to her, and then again, towards the end of the conversation, you notice something's off. So you ask her what the date is, and she tells you it's 2013, and then you ask her why she's here, and she says, "I'm here for a cheeseburger." And then you're like, "Ben, I just spent so much time talking to you, and none of this holds any weight." So don't get lost in the sauce. Hit him with the script. You know, you've been practicing, you know what to cover on the HMP. Don't forget your questions. Hit it with the fundamentals. ¿Cómo te llamas? What's your name? ¿Dónde estamos? Where are we? ¿Cuál es la fecha de hoy? What's today's date? ¿Por qué estás en el hospital? Why are you here? And this is how you get your A&O times 4. Did you use usted when you were talking to her? Because I hope you didn't. She's 26. You're probably older than her. If you want to be safe, you can always ask if she would prefer usted, but 99% of people that are younger than you will say no. Like, again, it's a respect thing, it's an elderly thing. If you're older than them, they would, if anything, they would want to refer to you as usted rather than the other way around. Um, I've actually had ladies get mad at me. They're like in their mid 50s, and I refer to them by usted, and they're like, "Oh, I am too young for that. You do not get to call me that. You refer to me by tú." And I'm like, "All right, ma'am, whatever you want." I'm sorry, not ma'am. "All right, girl, whatever you want." So, just something to remember. And then again, did you ask if it's okay to share her medical information with her husband? Don't assume that she's okay with it just because, or that she's okay with him interpreting to begin with, you know? All right, we have case number 3. I'm going to ask Natasha. Could you read this one for us?
Yeah, happy to. Okay, Mr. Oscar Ramirez is a 22-year-old male with no past medical history that was involved in a diving accident 1 week ago that resulted in a C7, I don't know what, ASIA, SCI. Primary team is consulting you for SCI recommendations. Can you say what an SCI is?
So that's a spinal cord injury.
Spinal cord injury. Okay.
Yeah.
You chart check and find patient was living with his parents prior to the injury. College student, works part-time at HEB. You see the Spanish flag in the chart. For this case, you are an advanced native Spanish speaker. You walk into the room and parents are at bedside, plus another couple who happens to be his aunt and uncle. What do you do?
Okay, perfect. So the physiatrist in me, the future academician in me, it's gonna take 2 seconds to just explain. So the Asia system is kind of like to help define a spinal cord injury, the AIS. So there's different levels, or different letters. It's A, B, C, and D, A and E actually technically. A means a complete injury. That means that at the C7 level, they had a complete injury to the spinal cord, and nothing under that level is functioning, if that makes sense. So no motor, no sensation under C7. Um, B is an incomplete, so there's some component of like motor or sensory, and then C and D, as you can imagine, is like there's increase in independence. This is not the lecture for that, but just wanted to explain that. So spinal cord injuries, Asia, you hear a lot of that in residency, and we do a lot of exams to help determine one, their level of injury, and two, if they're complete or incomplete, because that tells us about the recovery. So, yeah, so younger kid, he was in a diving accident. Unfortunately, he jumped into this pool that was like really shallow and just hit his neck, and then now he's here. Um, you see a lot of the times in hospitals, we will get consulted for spinal cord injury recommendations just because we are the experts on spinal cord injuries. And as you learn, there's a lot of things and changes to the body and management of like bowel, bladder pain that comes with having a spinal cord injury that other specialties are not as familiar with. Uh, so yeah, he lives with his parents, worked at HEB. No, you do see the Spanish flag. And for this case, you are an advanced slash native Spanish speaker. So again, I hope you native speakers are feeling represented tonight. Uh, you walk into the room. Yep. What happens now? So we don't want to assume, right? You want to ask them if they prefer English or Spanish. We saw on the chart that it said Spanish, but he's in school and he works at HEB. So I'm like, okay, I mean, you can go to school here and go to HEB, especially like in San Antonio. You can go about your day without needing a lot of English, but that piques my interest a little bit. That makes me question a little bit on that flag. So then I would always ask, even if the flag is there, I always ask. Don't just assume. Because turns out that Oscar actually prefers English because he's an English speaker. He's not Spanish. Someone just got it wrong whenever he came in. They saw the Ramirez on that last name, so they just smacked him with the Spanish speaking only. But he would appreciate if you could update his parents in Spanish. So what do we do next? We update, right? But we also had an uncle and an aunt in the room. So we want to clarify, is it okay for everyone in the room to hear this information? Do you only want us to explain things to your parents? One parent, both parents? Like what is the situation? So just always make sure you're being thorough and don't just assume because they're like, oh, it's okay for you to tell stuff to my mom, that they're okay with you telling stuff to their siblings or to their cousins or whoever else is in the room. And then, as a reminder, if you're doing an initial spinal cord injury eval, you're going to have to ask some pretty sensitive topics. We're going to be talking about bowel, bladder function, do you feel when you need to pee, all these other things. So you want to warn the patient ahead of time and ask if you would prefer to discuss those topics in private only. Don't assume that just because the parents only speak Spanish that you can get by in doing this interview in full English. They might catch on to some of the English. So again, you always just want to be respectful. Hey, we're going to talk about some sensitive topics. Would you want me to ask your parents to leave the room? Is it or your aunt to leave the room? Or is it okay if they're here whenever I talk to you about this? And then remember to still be professional with the family. Oscar may prefer to be addressed by his first name. Makes sense, he's 22. But whenever you're speaking to his mother, you want to call her by her last name. Whenever you're speaking to her uncle, aunt, dad, you want to refer to them by their last name and address them by usted unless they tell you tú, if you are at that level of your Spanish proficiency. Does that make sense? Perfect. Main takeaways. A lot of Spanish speaking patients in the United States and not enough Spanish speaking doctors. Patients without language concordant healthcare providers are more likely to experience miscommunications and adverse events. Cultural humility is not the same thing as cultural competency. Make sure you understand both concepts and see how you can apply them at your practice. Cultural humility, much easier to appreciate and practice at an individual level. Cultural competency would definitely take more work. Okay? Very hard to make generalizations about any groups, but for Hispanic patients, faith and family tend to be very important. Respect for your elders tends to be very important as well. When in doubt, just get the interpreter, but always make an effort to at least introduce yourself to them in Spanish. It'll go a long way with building rapport with them. You know, they'll feel more comfortable speaking with you about their issues and their concerns. And then last but not least, give yourself some grace. Learning a new language is not easy. And then just remember that you're making a huge impact on so many lives just by trying. It really does make a difference. Even the hola, I'm gonna get the interpreter, the adios, que Dios lo bendiga, those things can make a huge, huge difference. If you have any questions, I have my work email here, and I also have my personal email. You can take a picture if you want to need it. You can always feel free to reach out to me. I know maybe about half of this group personally or through other means, but for the ones of you that I don't know yet, don't be a stranger. My contact information is there if you need anything. You can also find me on social media. Am I gonna do it? Yeah, I'm gonna plug. I'm gonna plug. So Luis Valdez MD on Twitter and Instagram. You can find me there. I'll follow back, I promise. These are some of the sources that I use, especially for like the data at the beginning, the demographic and all of that stuff. I do have a feedback form. So I know we're a little bit over the hour, but if y'all could take a second, you could just like screenshot it now and then refer to it later. But if you would like to provide some feedback, I would really appreciate it. It's not mandatory, but it would help for future lectures that I give. So I'll leave this here for a second. And then that's it. Thank you. These are my kids. That's my wife. Santiago, right here on the left side with the Spider-Man PJs. He just turned 1 on Christmas. My daughter Ana Lucia just turned 3 a couple weeks ago. This is us at Christmas, matching Christmas Eve. As you continue to go through your journey in medicine and healthcare, always important to remember your why. It will help a lot with burnout. This is my why. So I just wanted to show it to you guys. And I think that's the last slide. Yeah, so we're gonna go back to the survey then. We'll go back to the survey for like a minute in case anyone is still trying to get in that link. And then, yeah, I'm gonna put the QR code. There it is. So I'm gonna leave it here for a second, and I'm gonna open it up. Unless we need to like get off the call because we're over the hour, I was just gonna open it up.